The subject now is prosthetic stenosis. It may be caused by calcification of the leaflets in a bioprosthesis, impaired opening due to thrombus or pannus. Endocarditis is not a common cause, but it may happen with a large vegetation, valve mismatch, and other causes. Let's see calcification. Notice here a bioprosthesis with a large calcification. This calcification is easily demonstrated when we see several dense arcs between the struts. Calcification may impair the valve opening and is a common cause not only of obstruction but also regurgitation in bioprosthesis. Remember that we usually see the leaflets as a very thin structure. M mode of a calcified prosthetic valve producing regurgitation looks like the same aspect as seen when produces stenosis. In an apical four-chamber, notice the leaflet's calcification. The short arcs demonstrate the gross dense echoes between and at the struts. Gross echoes at and between the struts, impairing leaflet movement. Prosthetic turbulent jet. It does not cover the whole sewing diameter of the prosthesis. M mode forming dense echoes lines with fine borders, typical of calcium. Very similar case. Dense echoes between and involving also the struts. Important mean gradient, LA-LV, of 24.6 millimeters of mercury. TEE shows severe impairment of the whole prosthetic structure, characteristic M-mode aspect of calcification, with several lines with fine borders. Let's see now Pannus. TEE of a patient with Pannus involving the mitral bioprosthesis with these dense echoes, mainly in this leaflet here. But all leaflets are involved, as demonstrated in the transgastric short X view. This aspect is not of a calcified leaflet. Calcium is not smooth as seen at this leaflet here. Notice the spontaneous contrast in the left atrium. Shows severe impairment. Pannus involving the mitral bioprosthesis with these dense echoes, mainly in this leaflet here. But all leaflets are involved, as demonstrated in the transgastric short X view. See how the echoes dense thickening is not gross and comes from the region of the sewing ring and involves the proximal region of the leaflet. Distal regions are less affected. Another example in an apical four-chamber, mechanical prosthesis. Note how various echo-dense material is spreading from the sewing ring toward the center of the orifice. TEE and the same patient shows that the left disc in the image is stuck, and it appears that a dense material coming from the sewing ring is the cause of the fixing of this disc. Color Doppler shows turbulent stenotic flow and 3 jets, what may be normal regurgitation. Another case, apical four-chamber, shows the basal leaflet to be somewhat fixed with normal movement of the tips. Color flow shows both the stenotic and regurgitant convergence velocities are related to the structure coming from the atrial side of the sewing ring. It seems to be a Pannus. This is confirmed by the TEE aspect. One of the leaflets is fixed and the other two move just the distal region. The denser feature that thickens the proximal leaflets comes from the sewing ring and is a Pannus. Continuous Doppler will reveal mean gradient in aortic prosthesis in general higher than 40 millimeters of mercury, when they shows severe impairment and between 30 to 40 when moderate stenotic. The mean gradient in a mitral prosthesis may be important if higher than 8 millimeters of mercury. I don't feel quite secure to subdivide in moderate or severe when in mitral position, but for sure, the farther it is from 8 millimeters of mercury, the more assurance. Shows severe impairment